Hello, student. It's our second lecture in orthodontics. We started the growth and development subjects of the dentofacial system. It's continue four lecture. That means we will be together for 1 month. Just we talking about the growth and development. It's very important for us to understand how the bone they will grow, how the teeth will be grow, to able select the best appliances for your patient. Okay, so we started the first lecture of growth and development. Firstly, orthodontics is a branch of dentistry concerned with the study of the growth of the craniofacial complex, the dental development of the occlusion, and the treatment of dentofacial abnormalities. We talked about this before. Orthodontic therapy involves the three primary tissue subjects systems concerned in dentofacial development: the dentition, the craniofacial skeleton, and the facial and jaw muscular. By means suitable appliances, the individual teeth can be positioned more favorable to provide better aesthetic, occlusal function, and oral health and speech. Okay. Correction of the craniofacial skeleton, however, is a different matter since it is much more difficult to alter the craniofacial skeleton than is to position teeth. That means the changes of the problem of the craniofacial skeleton is difficult to correct, or is more difficult than the correction of the position of the teeth. It is possible to direct the growth of the craniofacial skeleton in young children. For this is important to start it in a treatment in early age. Okay. In older patients whose facial growth is mostly completed, the teeth are positioned to function better and to camouflage any disharmonies of the facial skeletal patterns. Camouflage, that means not to correct the exactly problems of the patient. If they have a problem in the teeth, if they have a problem in the bones, you can, when he will be adults, you can manage the bone. Okay, so you try to make camouflage treatment. That means you put the teeth in occlusion but without change in the bone. Okay, it mean this is meaning of the camouflage treatment. Okay. Humans life cycle started from fertilized egg, then go to the embryo grow to the neonate. The fertilized egg, embryo, and neonate still in the mammary and they grow. They will be born to be child. The child will be grow to be adult. Adult, they started again fertilizing egg, or they will go to the death. Okay, this is life cycle of the human. Growth is defined as the normal changes in amount of living substance. Growth is the quantitative aspect of biological development and is measured in unit of increasing per unit of time. Example, that means if you in 1 year maybe growth in millimeter, and in per day or in month you increase in your weight. Okay. Growth is the result of biological process by means of which living matter normally gets larger. It may be the direct result of cell division or the indirect product of biological activity. Example for this is bone and teeth. Development, all the normal sequential series of events between fertilization of the ovum and the adult state. Okay. There are three important aspects of developmental growth, like increase in the size of the cell, cellular differentiation, and morphogenesis. Maturation, the stabilization of the adult state brought about by growth and development. Here, the growth and development they will be stopped or finished. Then, maturation state will be started. Okay. Methods of studying physical growth and development. There are many methods for studying how the human body or how the bone or teeth they will be grown. First of one is opinion. when looking at the living creatures around us, puts forward an idea about development. This opinion is not have a value of scientific. That means just I'm thinking. I said I thinking the growth of the bone or growth of the teeth like this, but it's not related to the scientific. Okay, it's not related to the knowledge. Observation are useful for studying all or non phenomena. Like example, congenital absence of the teeth. We need really observation. We see for 1 year, we observed there are many patients of coming to the clinic. They have congenital absence of the teeth. Quantitative measurement to find real scientific results. This measurement must be got by taking data from the patient. Okay, this is real scientific results. There are three methods to make measurements. First of all, direct data. Direct growth data are measurements taken on the living child or cadaver by means of calipers, scales, measurement tabs. Cadaver, it mean is a dead body. Okay. Indirect data, indirectly growth measurement are those taken from images or reproduction of actual person. Measurements made from photographs, dental casts, or cephalograms. Derived data, these data are obtained by comparing two other measurements. That means comparing direct data and indirect data. Variables affected in physical growth. First of, and very important one is heredity. That means genetic studies. There's most of the diseases and most of the variable changes they coming from the it's related to the genetic. They coming from your family. Okay. Genetic studies of physical growth make us of twin and family data. Differences between monozygotic and dizygotic twins are assumed to be differences due to the environment. There is a genetic control of size of part to great extent, of the rate of growth and of the onset of growth events, dental classification or the eruption of the teeth. For this, there's some family they have genetic diseases. It's very very dangerous. So when he married, he can selected them or he selected the type of the children. There is a genetic studies, and he can do. He can. There is very special labs in Europe and America. They can select your baby without this is genetic diseases. Okay, and this is very important, especially for families they have dangerous genetic diseases. Nutrition, malnutrition during childhood delayed growth, and adolescent dispute in growth. Malnutrition may affect the size of parts, body proportion, body chemistry, and the quality and the texture of certain tissue, like a bone and teeth. Okay. Also, malnutrition in pregnant period, they lead sometimes to the cleft lip and palate patient. Okay. Illness, systemic disease has an effect on child growth. Illness, that means diseases, that he's always sick. Okay, but the plasticity of the human organism during growth is so great that the clinician must differentiate between minor illnesses and major illnesses. The usual minor childhood illness ordinarily cannot be shown to have much effect on physical growth. On the other hand, the serious prolonged and debilitated illness have a marked effect on the bone. Race, that mean there is a, you know, in the world there are many different people or different people, like white people, black people, and yellow people. So this race is also affected on the growth of the. They have a different effect on the growth of the bone and facial. Okay. When the price is control of all variable other than race, it can be shown that there are racial differences of some significance in birth weight, height, and weight growth rate, and the onset of various nutritional indicators. Okay, climate and seasonal effect on the growth. Environment also is affected, and where you live in places. There is a general tendency for those living in cold climate to have a great proportional of adipose tissue because he's less movement or less do sports or something like this. And much have been made of the skeletal variation associated with the variation in climate. There are seasonal variation in the amount of growth rate of children and in the weight of a newborn baby. Adult physics. There are correlation between the adult physics and earlier development events. Tall women tend to mature later as well as having variation in the rate of the growth with differing somatotypes. Okay, and socioeconomic factors also is affected on the growth and development, or it's like effect on maybe the change of the nutrition. Okay, it's related to the socioeconomic, so also affected on the height weight ratio. Exercises, you can see there is a strong case of beneficial effect of exercise on growth has not been made in quantitative fashion. Also, it may be useful for the development of motor skills, for fitness, and general well-being. Those children who exercise strenuously and have not been shown to grow more favorable. Family size and birth order. There are differences in the size of the individual in their maturation. In one family, you can see there is one child they have grow faster than the other. Okay, or you say there is erupted teeth earlier. And other one they will be his teeth they erupted later or late. Okay, so it will be different. Always we can see firstborn children tend to weight less at birth and ultimately achieve less saturated and higher IQ. Circular tendency, size and maturational change can be shown to be occurring with the time that as yet have not been well explained. So, 15-year-old boys are approximately 5 inches taller than 15 years old boys were 15 years ago. So by the time the size or the length of the persons or human, they will be changed. And also you can see that we have before four molars, now we have three, and maybe by the time we have adjusted two. So by the time everything they will be changed. Before pubertal, pubertal is very important for us during treatment, and we must know which time they will be peak and which time they will be low. Okay, or also we must know which time is before the pubertal to starting treatment with the patient, and by which if you know, you can select which type of appliances you use it for them. Okay, before puberty, this reduction is a minimum and called minimum puberty. It's start is before 11, 10 and 11 years old. Okay, starting from this period of growth through puberty, sprout reaches its maximum. Maximum puberty is called maximum puberty. This is will be changed from from girls to boy. In girls, it will be 11 to 14 years, and in boy, they will be 13 to 18 age. Okay, so it will be different. So if the child they come to me, I must firstly know which age. Okay, and if she girls, I must if she come in early, I must start it with her earlier. But if he's boy, I must wait little bit for them, and then I can start it for them because I know they have a time for growth. Okay, they will be late growth or later than girl. Okay, the growth rate then will be decreased and reset to reach adulthood. From 14 for girls till 18, we have very little size in growth, but the boy they always continue to 18. Okay. Maturation, after the growth and development have been complete, the individual enters the period of maturation. It is important to determine the degree of maturation. Also, it's important to know how much that in growth and development to complete. It's very important for us to know for which time we started the appliances and when we can, for which time we can continue the treatment with them. Okay, so the maturation time is very important. We can detect it by three type of level. It's first is chronological age, and the second dental age, and third is skeletal age. This is very important. Chronological age is our age, normal age in a year from the birth. I'm like 13, I'm 14, I'm like you is 20 age. This is a chronological age. It's your age from the birth. Okay. Dental ages is it's related to the calcification root and root formation, the completion of the root, and the teeth will be continuing eruption at certain time. There is a schedule. You know which time the time of the eruption of the teeth, upper and lower, for deciduous and for permanent teeth. So we can put it the exactly age of the patient. But this is dental age. Skeletal age, classification of the different bones is determined according to various degree. An assessment of skeletal age must be based on the maturation state of markers within the skeletal system. Also, a number of indicator called theoretical be used. The ossification of the bones of the hand and the wrist is normally that standard for the skeletal development. That means we skeletal age is very important for us to know how much they have a time or they started the maturation or not. He's in pubertal age or not. This is very important. We look into the bone of the um look into the bone of the hand rest. Okay, we take an X-ray and we see there is ossification or not. A radiograph of the hand and wrist provide a view of some 30 small bones, all of which have a periodical sequence of ossification. If there is ossification, that means complete ossification. That means he's fully maturated. If there is no little ossification, that means he's have a time. Okay, so can you follow your patient by hand rest X-ray? Okay, it's very important for us. Growth and development are examined in prenatal and postnatal. Prenatal, that means in uterus. Okay. Postnatal, that means he's after born. Okay. Growth and development start from the beginning of the prenatal period and will continue without interruption of the postnatal period. At the birth is only the median differences. Okay. And see you next week. I hope you understand. And if you have any question, I'm ready to listen to you. Okay, I wait you next Wednesday at 8:30. See you.